Early cancer detection can reduce the cost of treatment and care for patients and health systems in several ways. First, it can increase the chances of finding certain cancers early, when they are small, have not spread, and might be easier to treat. This can improve the survival and quality of life of people living with cancer. Second, it can lower the need for more expensive and complex treatments that are required for advanced stages of cancer. This can also reduce the side effects and complications of treatment that can affect the physical, mental, and social well-being of patients and their caregivers. Third, it can prevent unnecessary suffering and early death from cancer that could have been avoided with timely diagnosis and treatment. This can also reduce the economic burden of cancer on individuals, families, and societies. According to the World Health Organization, WHO, screening tests are used to find cancer in people who have no symptoms. The screening tests you need and when you need to get them might be different from other people because of your age, gender at birth, and certain risk factors you may have. Some examples of screening tests for common cancers are mammograms for breast cancer, Pap tests for cervical cancer, and colonoscopies for colorectal cancer. The Affordable Care Act, ACA, requires both private insurers and Medicare to cover the cost of certain cancer screening tests. But if a health plan was already in place before the ACA was passed, such as in grandfathered plans, it might not offer the same coverage. You can find out the date your insurance plan started and if your recommended screening tests are covered by contacting your health insurance company. Another way to detect cancer early is to be aware of the different cancer symptoms and signs and seek medical care when you notice any changes in your body that are not normal for you. Some common symptoms and signs of cancer are unexplained weight loss, fever, fatigue, pain, skin changes, lump or swelling, bleeding or bruising, persistent cough or hoarseness, difficulty swallowing or breathing, changes in bowel or bladder habits, or sores that do not heal. However, these symptoms and signs can also be caused by other conditions that are not cancerous. Therefore, it is important to consult a doctor who can perform accurate and timely diagnostic tests to confirm or rule out cancer. Diagnostic tests are used to find out if a person has cancer and what type of cancer it is. They can also provide information about the stage of the cancer, how much it has grown and spread, and help plan the best treatment options. Some examples of diagnostic tests for cancer are biopsies, taking a sample of tissue or cells for examination under a microscope, blood tests, measuring substances in the blood that may indicate cancer, imaging tests, using X-rays, ultrasound, MRI, CT scan, PET scan, or other methods to create pictures of the inside of the body, or genetic tests, analyzing DNA changes in cells that may cause or affect cancer. The type and number of diagnostic tests you need depend on your symptoms, medical history, physical exam findings, and screening test results. The cost of diagnostic tests for cancer can vary depending on the type of test, the provider who performs it, the facility where it is done, and the insurance coverage you have. Some diagnostic tests may be covered by your insurance plan as preventive services or as part of your treatment plan. However, some diagnostic tests may not be covered by your insurance plan or may require prior authorization or copayment. Therefore, it is important to check with your insurance company before you get any diagnostic test to know exactly what will be covered and what your out-of-pocket costs might be. Early cancer detection can save lives in dollars by finding cancer when it is most treatable and curable. However, not everyone has access to affordable and quality screening and diagnostic services for cancer. There are many barriers that prevent people from getting screened or diagnosed for cancer, such as lack of awareness, fear, stigma, cost, transportation, language, culture, or health system challenges. To overcome these barriers and improve early cancer detection for everyone, we need to work together as individuals, communities, health professionals, policymakers, researchers, advocates, and organizations. We need to raise awareness about the benefits of early detection, educate people about the symptoms and signs of cancer, encourage people to get screened according to their age and risk factors, provide financial assistance and insurance coverage for screening and diagnostic tests, ensure access to accurate and timely diagnostic services, support people living with cancer throughout their journey, invest in research and innovation to develop new and better ways to detect cancer, and advocate for policies and programs that promote early detection of cancer. Early cancer detection is the process of finding cancer before it causes symptoms or spreads to other parts of the body. It can be achieved through screening, awareness, and innovation. Screening is the use of tests or exams to check for signs of cancer in people who have no symptoms. Some examples of screening tests are mammograms for breast cancer, colonoscopies for colorectal cancer, and Pap tests for cervical cancer. Screening can help find cancer at an early stage, when it is easier to treat and more likely to be cured. Awareness is the knowledge and understanding of the risk factors, symptoms, and prevention strategies for different types of cancer. Some examples of risk factors are smoking, obesity, and exposure to harmful substances. Some examples of symptoms are lumps, pain, or bleeding. Some examples of prevention strategies are quitting smoking, eating healthy, and avoiding sunburns. Awareness can help people recognize the signs of cancer and seek medical help as soon as possible. Innovation is the development and application of new technologies and methods to improve cancer detection and diagnosis. Some examples of innovation are artificial intelligence, biomarkers, and liquid biopsies. Artificial intelligence is the use of computer algorithms to analyze large amounts of data and find patterns that can indicate cancer. Biomarkers are substances that can be measured in the blood or other body fluids and can signal the presence or progression of cancer. Liquid biopsies are tests that can detect cancer cells or DNA fragments in the blood or other body fluids and can provide information about the type and characteristics of cancer. By combining screening, awareness, and innovation, we can achieve early cancer detection and save lives and dollars. Early cancer detection can reduce the mortality and morbidity of cancer by increasing the chances of successful treatment and reducing the need for invasive or costly interventions. Early cancer detection can also reduce the economic burden of cancer by lowering the direct costs of health care and the indirect costs of lost productivity and income. In conclusion, early cancer detection is a vital strategy to fight against cancer and improve the quality of life for millions of people around the world. We should all take advantage of the available screening tests, be aware of the risk factors and symptoms of cancer, and support the innovation that can make cancer detection faster, cheaper, and more accurate.